Welcome back to the Morning Blend. Well, women, especially women over the age of 40, begin to experience hormone imbalance, and this can lead to weight gain, limited energy, low sex drive, and more.
But now there's a new place to turn to in Milwaukee area that can help you. Joining us now from the NuFemme Rejuvenation Clinic is Dr. Christopher Asandra, along with physician's assistant Jennifer Hipp. Thanks for being here, you guys.
Thanks for having us.
Good to see you.
This is great. You just opened up last week. Tell us a little bit, just an overview of what NuFemme is.
Well, NuFemme was actually developed kind of out of new male. New male, we had such an overwhelming response from the men that came in, and their wives and significant others would come in too and say, "Hey, you fixed my husband. Can you fix me?" And we decided to kind of, and that's how NuFemme was born. So we decided to make a clinic just for women, and just so we can treat all their problems and ailments and kind of take a wellness approach to it.
What's a common reason, starting with new male, and I want to talk mostly about NuFemme, but what's a common reason someone might visit? And then, same with NuFemme, what's a common reason or common complaints that you hear?
You know, as we age, we lose energy. We don't feel ourselves anymore. We start declining about after the age of 30 and 40. Our hormones just start going down and down and down. Menopause, andropause for men, all these little things just, and people just want to feel lively, and with all the stress going on, they want to feel lively again and have that energy again.
And this is an estrogen graph. What are we looking at here?
So you can see here on there, it's like menopause. You see the kind of towards the right side there in the middle, how our hormones start declining right at that age there and just start tapering, declining and falling off the charts there. So the goal is to replace them back to the green levels so you feel like you did when you were 20, 30 years old again.
Bioidentical hormone therapy is something that's kind of been a buzz.
Sure.
And it's very valuable, the fact that it's bioidentical.
Correct.
What does it mean and how is it beneficial to women?
Sure. So bioidentical hormone replacement therapy is mimicking the body's natural release of their hormones. You always hear about these synthetic hormones that you can buy over the counter and all that, but that's not natural. That doesn't mimic the body's natural response. And so the goal is to replace those hormones and have the body release those hormones at a very natural and steady level over time.
What about pellet therapy? That's kind of like the buzz right now, right?
Pellet therapy is kind of the newer way to go now, and that's bioidentical. So you've heard about the creams and the pills that you take, but you get this roller coaster effect with it. By putting a pellet in, you get a steady state for about 6 months of just steady state of release of whatever hormone you need.
Is the pellet something you take or you insert?
It's actually just surgically implanted. It takes about 2 to 3 minutes, right under the skin, right into the fat, and it's painless, and literally you're set for about 6 months.
Can you see it?
Can't see it at all or feel it. No.
Wow. That's amazing.
It is.
Tell us about the vampire facial, because one of the things I like about what you do is that you want to fix women, so to speak. Maybe you get their hormones balanced, but you want them to look and feel good too.
From the inside and out, yes. So the vampire facial, there's a new thing out there called platelet-rich plasma. That's using your body's own stem cells and platelets to actually heal.
Kim Kardashian.
There you go. She had it done.
We've heard about her doing it. So what does she have on her face?
So she's actually got platelet-rich plasma there. So you draw the blood and we use a special machine and harvest the stem cells, that magical part of the blood that heals the body. We put it on the face and then we microneedle it in or inject it actually into the facial parts, and it actually rejuvenates the face, and you can see you pretty much get a facelift with it. Naturally.
So is there a lot of medical background to it? It's not just hype. It's not just something, that sounds great because a celebrity did it. There's actual medical findings behind it.
Absolutely. It was originally used in orthopedics, and they found that by using PRP and joints and everything, and athletes heal faster. Kobe Bryant had it done. A lot of these athletes are getting it done, and they heal and they come back on the field faster. Well, why not apply that to aesthetics? And so this is kind of the new thing. About 75% of the women who get the PRP in their face actually go away from Botox, and they love this.
Really?
Yes.
Interesting.
Absolutely, yeah.
What about medical weight loss?
Well, medical weight loss is right along the same lines as the bioidentical hormone replacement at our clinic. We're different than other clinics in that we don't take a cookie cutter approach, and the foundation of everything is replacing your hormones, balancing your hormones, so that when you do the things you should, you have a healthy diet, you have a healthy lifestyle, healthy exercise, you actually lose weight. So many of our women come in really frustrated because they've tried all the lifestyle changes and they're sticking to it, but they can't lose the weight.
Yeah. Well, and Jennifer, just talk about the fact of when you come in, because I think this is something that's really valuable to point out about what you do at NuFemme, is when you come into the clinic, you're not sitting in a waiting room with a lot of other women. Talk about the privacy factor.
We spoke about that a little bit last episode, and women, a lot of these issues are very embarrassing for women. They don't want to be in a waiting room with a lot of other patients. Everyone's roomed right away. We hold your privacy to the highest standard, and it's me and myself and the patient in the room. It's not a bunch of other staff. There's no men in our clinic, and so they really feel very comfortable. There's our staff actually in our brand new clinic. So the women really, we try to learn about them. It's not just to sit down and this is your laboratory, this is your medical history. I need to get to know you so I can, use all of our modalities to get you to that optimal level.
Yeah, there's a sensitivity. It sounds like that comes with it
Very
because,
much.
like you said, it can be very embarrassing, or there are things that people aren't real comfortable talking about, but they really can relax and talk to you guys about it.
And sexual wellness in particular, I would think falls into that category, but that's
Yes.
something you specialize in as well.
Absolutely, and that's kind of the crux of both of our clinics. A lot of men come in because a lot of the hormonal imbalance leads to primarily, or if the first thing they notice is sexual dysfunction, but they don't notice all the other things that we notice as women: weight gain, hot flashes, you get foggy, your concentration goes away, you can't sleep, you're very moody, and that's just kind of in the milieu. So we do treat sexual dysfunction in a completely different way than any other practice or clinic that you'll go to, in that we balance your hormones, and that alone restores a lot of women to optimal levels. But in addition to that, we have just a laundry list of really amazing procedures as well as other therapies. Dr. Asandra spoke to the PRP for the face. We also use it for the sexual organs. So it helps with lubrication, sensitivity, desire, all the things that women think they should have their whole lives, but then when their hormones become imbalanced, goes away, and they tell me, I love my husband, I love my partner, but I just can't make this work. The physicality isn't happening for them anymore. So
it's wonderful that people have a safe place to talk about it too. And for $199, you'll do a consultation with women that's very private, and I think your sensitivity to it is so important. If people call this phone number, it's 414-875-3833. Their office is located on North Mayfair Road in Wauwatosa. Again, the consultation for $199 just really quickly includes what?
Usually includes your blood work. So we test 11 different hormones on the female: estrogen, progesterone, thyroid, all these different things that we need to find out, because hormones are like a symphony in women. If just one instrument is not playing right, the others don't play right as well. So we test about 11 different hormones with that as well.
It's wonderful. Great
Thanks
to have you guys
so much
here.
for being
Thank
here.
you.
Thank
Thanks
you
for
so
having us.
much.
Appreciate it.